Welcome to the program. I'm Roby Broughton. Joining me now, Peggy Abbott. She's the president and CEO of the Ouachita County Medical Center, and Chad Aduddell, market CEO for CHI St. Vincent. Chad, I will give you a chance to tell me if I mispronounced your last name there.
You got it. Hit it right on the head.
All right. Well, thanks to both of you for being here. I know that these are some serious times for Arkansas hospitals. To begin with, I just want to say, as a citizen of the state of Arkansas, thank you both and your peers and colleagues for everything that you guys have done through the pandemic. It has been a difficult time. I just want you to know, as just an average citizen, as well as somebody that covers this stuff day in and day out, I'm very thankful that you guys have been there and for the hard work that you guys put in. I know how difficult it was. So thank you for that to begin with. Set me up with the economic scenario. Peggy, I will come to you first. In terms of what you're facing, you've got increased labor costs, particularly in the nursing area. You've got a higher cost of goods for medicine, for supplies, for equipment. How are you coping? How is your hospital system coping with all of these higher expenses?
Well, we certainly recognize that all hospitals nationwide are facing unprecedented times with the level of reimbursements that we're getting as compared to the cost of operating. We're challenged and struggling to sustain those negative impacts, just as every other facility is. In a rural setting, it becomes more challenging. We're an independent hospital. We've been in operation for 70 years. And unlike the systems, we don't have a safety net under us, so to speak. But I do have to interject, Roby. When we see some of the major systems posting the year-to-date losses that they're posting, that should cause alarm to those who could maybe step in and help make a difference. When we're posting losses, that means that we're spending money that we have set aside in reserves. The big systems and in the little hospitals, we're often operating on a day-to-day basis. We have had significant challenges with increases in labor costs throughout COVID-19 because we're suddenly competing with those contract agencies that are offering exorbitant fees, and even some of our own staff members would leave to go to work for those entities. I can't fault them for that. Everyone wants to make more money, but it put the hospitals in kind of a catch-22 situation, in that we're having to increase some of our just general labor costs for our clinical staff in order to retain them. And by the same token, during COVID-19, staff is sustaining burnout. They're tired. The patient load is just unbelievable for all hospitals. One day, every patient in our hospital was a COVID positive patient, including those on our maternity wing. So there were unprecedented times, and I do applaud all of, just as you said, all of those who were working alongside us.
Yeah. Let me get Chad to weigh in on this as well. Chad, tell me kind of what you have been dealing with in terms of the economics of how to make a hospital operate efficiently and profitably, or at least to hang on until better days.
Yeah, great question. Hospital margins were slim before COVID, and COVID has certainly exacerbated the challenges of operating a hospital or a healthcare system, especially in a state like Arkansas, where we're reimbursed lower than the rest of the country, whether it's our reimbursement from Medicare or our reimbursement from commercial payers. And that's something that I think a lot of Arkansans are unaware of. So from the beginning, we're already at a baseline that's behind the rest of the country. You add double-digit increases in costs, whether it's on the labor side, supply chain side, that certainly COVID exacerbated over the last 2.5 years, and then add on other macro level inflationary impacts. And it's really a perfect storm as we try to recover from COVID. So we've seen our expenses were up more than 10%, which for us, our expenses are up over $100 million versus the pre-COVID year. And yet our revenues and volumes are actually down. So you don't have to be a finance leader to know that math's not going to work out and not going to be sustainable.
This question for both of you too. Peggy, we'll start with you. Just add into the mix that there was a lot of stimulus money coming into Arkansas for COVID-19 and certainly helping support a lot of the healthcare system that was critically needed, obviously, during that the COVID-19 pandemic. How dependent were hospitals on that? And I guess, is that what you're feeling even some bigger effects from too, in addition to these inflationary pressures and the fact that, you know, these labor costs have gone up and up because there is this nursing shortage?
Well, I think perhaps it could be, as Chad stated, pre-COVID, we all had more narrow margins than we had ever experienced before. I've been in healthcare for 35 years, and we had some of the most narrow margins pre-COVID. So of course, the injection of the stimulus monies were a blessing. I'm not sure we would have sustained the pandemic without those monies. And there were both a blessing and a curse. You know, we had to justify the use of those monies. It was not just given to us to keep indefinitely or to stick in the bank account to be a reserve. We had to justify that we had expended that, or according to some IRS regulations, repay some of that money. Fortunately, most hospitals were able to justify the use of most of it through loss of revenue or the increased labor cost. You know, we all took advantage of something called a Medicare accelerated payment that projected what some of your Medicare payments would have been going forward into the future. We accepted that. Then you have to repay that. So right now it's biting all of us in that it started off being a 25% withhold, then it has now increased to 50%. And come October the 1st here in Camden, if we don't have ours repaid in full, it will be a 100% take back with a 4.5% interest rate added to that. What has caused it to stretch out so much longer? As Chad alluded to, our census days are down. Our Medicare population days are not what they were even a year ago. We are sustaining, our revenue has decreased year to date, June 30th of this year, over 1 year ago. Our revenue has decreased $2 million. Our salaries have increased $1.7 million, and contract labor for use of agency staffing increased $800,000 this year to date over last year, putting that number at 1.3 million. Insurance rates have increased hundreds of thousands of dollars. Overall, we have fewer days of cash on hand than I have ever seen. We are really at a crisis point, I think, not just here in Arkansas, but in America. And I have a concern that it could be the collapse of the healthcare system as we currently know it, if we don't get some balance to reimbursements from both insurance companies, as Chad said, as well as Medicare and Medicaid. And I think it's time for the powers that be to pay attention. Don't forget us. Yeah. We're very important.
Chad, I'll let you compliment what Peggy just had to add there to kind of put it from the perspective of what you've been dealing with in terms of the stimulus money, the fact that it's not as large as it once was, and kind of how you guys are coping and what is needed to cope with this going forward.
Yeah, Peggy hit it on the stimulus money. I mean, it got us through 2020 and through 2021 when the COVID surges were so significant. Really, we spent a lot more on agency labor and on the medication to take care of COVID patients than the stimulus money funded. So we were in the hole from that, but that money's gone. And now we're trying to recover, even though there is still COVID in our communities that we're serving. I've got 30 COVID patients in hospital beds today across our hospitals, but that money is long since run out. I'm going to give you a headline from earlier today that I think sums up what Peggy said. So this is not an opinion. This is from Fitch Rating Agency. They changed their outlook for nonprofit healthcare sector to deteriorating as of today. And they base that on labor and broader macro inflationary pressures. And then they expect that the elevated expense pressure related to labor expenses are going to be permanent. So as we've increased wages during COVID, both nursing and non-nursing, those wages aren't going to go back down. So now, yes, there was a nursing shortage that contributed, but it's all the positions across our healthcare system, not just the nursing positions that are being impacted. I'm not just competing with other hospitals in Little Rock or even other hospitals around the country. I'm also competing with retail. I'm competing with restaurants, and they're paying a lot higher than healthcare systems and doctors' offices are. And we can't afford to increase our wages to match those competitors. You say, why can't you do that, Chad? Well, what do they have that we don't have in healthcare? They have price control. Retail restaurants experience inflation, they increase prices, they pass it on to the consumer. We experience inflation, increase wages. We can't pass that on to the consumer. We don't have price control. Our reimbursement, 75% of my reimbursement comes from Medicare and Medicaid from the government, and only about a quarter of our business comes from employer-sponsored health plans, commercial insurance. So, and again, even working with them to try to help offset inflation, the increases that we're receiving or that we're all going to be asking for aren't going to keep up with inflation. And Medicare and Medicaid certainly aren't keeping up with inflation and aren't scheduled to keep up with inflation in the future.
Well, let me stick with you, Chad, on this thread that we're on right here. And Peggy, I'll come to you for your take on this second. So what solutions, what options are out there? You're hitting around that the insurance rates have got to, the reimbursement rates have got to change. Lobbying the government for higher reimbursement rates for Medicare and Medicaid is an option. I would assume that consolidation and merger in the healthcare system is another option that's probably being discussed among some of your peers, and cutting services. What options are out there for you guys to consider?
Yeah, first, we're all operators and we're all going to look internally at the things that we can do leaner, more efficiently. Every hospital in Arkansas and probably across the country are doing that work. And candidly, we have been doing that work during COVID. So that's already baked in. We've already made as many of those cuts and changes as we can. And now we're laying people off, and that's unfortunate, but that's the step that we were at in July. So what comes next? Well, reduction in services, consolidation of offices and different access sites. So that's going to make it harder for the community, for Arkansans to access a location that's close to them. So those are some of the things that we're doing to try to trim and keep the doors open. But then to your question, we're going to be working with legislators at the state capitol to look at, okay, what can we do locally? But then we're really going to have to work with the folks in Washington to say, okay, Medicare was scheduled for a 2.5% increase in 2022. 2% of that went away from sequestration from the Budget Reduction Act from 10 years ago. And so that just now took effect. And so our 2.5% increase that was well below inflation was actually a 0.5% increase. And then we took a 10% reduction on the physician fee schedule. So we're actually negative from our biggest payer, which is Medicare, when costs are up more than double digits. So it's going to be a conversation and advocacy with folks from a federal perspective, because what we're being paid to take care of the biggest demographic that we serve, we're not even coming close to covering the costs on that demographic.
Peggy, do you think that your congressmen and senators have heard this message loud and clear?
A few weeks ago, I decided to sound the alarm. And here at Ouachita County Medical Center, we started a grassroots letter writing campaign. And I will say that Congressman Bruce Westerman made the time to come and meet with us for a little over 2 hours. He heard it. He listened to it. Whether it can take legs and get boots on the ground and orchestrate any changes remains to be seen, because it's a big change to orchestrate. Locally, I've reached out to one of our representatives, David Felding. He's been fanning the flames. We've had conversations with the governor's office. We're trying to make people aware that we are at a crisis point, not just in Camden. That's a heavy word to use, but as Chad has alluded to, we are there. It's real. And, we don't get the opportunity, and we don't want to. We start orchestrating change right here. I applaud the hospitals in Arkansas because we try to make the change and make it happen. We start in the C-suite. In Camden, I voluntarily reduced my salary. Many of our managers did. We had to make the heart-wrenching decision to close the service of a rural health clinic 20 miles from here that we'd operated for 25 years. Those are not easy decisions, but we have to try to protect the mothership. And if I may allude to something, that something called a rural emergency hospital is spreading like wildfire. It's a great model to provide some services, maybe in certain areas, but we must not let go of our full service rural hospitals as well as our urban hospitals. If you will read about the rural emergency hospital designation, you can keep a patient for 24 hours. And then what happens? People like Chad are trying to figure out how they're going to house these patients who we can't keep any longer. And they're struggling with staff shortages. That's not the answer either. We could heal this on the reimbursement side by just a little give and take by the private insurance companies and by Medicare and Medicaid. I'll make one statement. There are a lot of things that we can do without on an individual basis, but most every Arkansan and most every American at one time or the other in his or her life will need a hospital, either at birth or at death or somewhere in between. We're just an industry that's very unique in and of itself, and everyone needs us at some point, and access to care is critical. The OB patient, we are one of 2 hospitals in this section of the state that provides obstetrical services. What happens to that woman who comes in an emergency situation and we're a rural hospital designation and we have to try to get them to Chad's hospital a couple of hours away? What happens? There's a lot to think about before we put the elimination of hospitals on the table.
All right, the sirens are sounding. It's not just Arkansas, it's nationwide, but it is particularly here in Arkansas. Peggy Abbott, Chad Aduddell, I appreciate you both sharing your perspectives with us. Thank you so much.